Good afternoon and good morning to some of you. It's a pleasure to welcome you to today's webinar, which is Optimizing Healthcare Facilities, a Comprehensive Approach to Building Performance and Safety. I'm Stephanie Davis. I am Terracon's National Director of the Healthcare Business Sector, and it is my pleasure to kick things off today and to be with you and to introduce our esteemed panel of presenters. But before I get into introductions, I'd be remiss if I did not make reference to the fact that last week was National Construction Safety Week. And safety is something that is extremely important, certainly paramount to Terracon, all Terracon employee owners. We want to ensure that everyone goes home each and every day safely to their families. So we each have a responsibility for safety, and I certainly want to ask each of you a challenge and encourage each of you to think about that and have that same attitude for safety each and every day. So now let's get on with introductions. You all know why you're here. This is, something that hopefully in the invitation resonated with you. Maybe it was something, maybe curiosity about pavement management or issues you may be experiencing related to industrial hygiene within your facility, or perhaps you're interested in learning more about evaluating and managing your facility assets. But whatever the interest was, or whatever resonated with you or piqued your curiosity, I want you to know that our speakers are certainly subject matter experts. They are gurus in their respective fields, and I'm thrilled that they're able to share their insights and experiences with you today. I'll introduce them, and I will ask that you please hold any questions and comments until the end of the presentation. We have allotted about 15 minutes at the end to entertain questions and have an interactive session then. Feel free to post any comments or questions in the chat, and I'll be sure to go back to those at the conclusion of the presentation. And then lastly, I did want to mention that we are recording today's webinar. So Bill Collister is our National Client Development Manager for Pavement Consulting. He has been in the construction industry for more than 20 years, with 5 of those at Terracon. He told me that one of his most favorite hobbies is gardening. And as Terracon's National Manager for Building, Environmental Sciences, and Industrial Hygiene, Amanda McKinney has 21 years experience, 21 years at Terracon, 25 in the industry. When I asked her about her favorite hobby, she said she claimed that she had none, but that she is a huge Georgia Bulldogs fan, and that her daughter just recently graduated from the University of Georgia. Sorry, Amanda, the University of Alabama. So I'm sure it pained Amanda slightly to write those checks every month to the University of Alabama, being such a big Georgia fan. But congratulations to your daughter, Amanda. And then lastly, Greg Walterscheid is our National Director of Facilities Consultant. He's been Facilities Consulting. He's been with Terracon for about 11 years, a little over 11 years, but has more than 38 years of experience in both the environmental and facilities consulting areas. Ranching is one of Greg's most favorite pastimes. So again, really excited to have these 3 with us today, and excited to hear what they have to share with you. And so with that, I'll turn it over to Bill to get us started.
Thank you, Stephanie. I appreciate the opportunity to be in front of everyone today to talk about pavement consulting. It's something that Terracon thinks is a very important subject to talk with to the healthcare industry, and we're excited about the opportunity to be here with you today. So when we talk about pavement consulting, we're talking about things that are impacting not just the safety of your buildings, but the aesthetics of your building. And we really think about the pavement in really a couple different ways. We think about it from an appearance. We call that social capital, and what you're presenting to the market that's out there. We talk about safety and risk assessments, and making sure that you are thinking about your safety programs, savings and capital. Everybody loves talking about how can we help you save money. But that capital planning approach for hospitals is also something that's top of mind for a lot of clients that want to understand how can we help better save them money and produce them a longer term product. We're going to talk a little bit about that today. But lastly, the operational efficiencies. what maintenance and repair strategy should we be thinking about from an overall perspective to maintain our uh, pavements in a better, more efficient manner. So when Terracon thinks about pavement consulting with our clients, we think about that in a life cycle. We think about the things we just talked about, the operational efficiency, the safety, the appearance, and that really starts with evaluation and data. When we look at the evaluation, we can then look at what is happening currently. We can start tracking trends and data on your pavements to understand where you are spending money, where you need to be spending money, and what does that look like for the future. We talk about the maintenance and repair strategies that are impactful to your area and what can you do to introduce better strategies to ensure that we're extending the life of the pavements beyond just the repairs that you're doing on a day-to-day or year-to-year basis, but what kind of strategy can we really put in place to help you extend the life of your pavement and save the money that we're talking about. And then certainly once those repairs are needing to be made, we talk about the design component of that and helping you to bid your projects from a repair perspective or a reconstruction perspective to what your budgets are and what are the specifications for your specific areas. Many of you on the call may have locations in different parts of the country, and those specifications for designs may be different in those areas of the country. Although they may all be asphalt pavements, we may want to look at that a little bit differently from a perspective of management. We want to understand how we can help you to look at that. And last thing is the savings through long-term pavement management. I'll show you at the end of my slides an example of a client that we've been working with for many years and have been able to save them extensive dollars in savings on their planning. But that's really an impactful way for us to prove that doing long-term pavement management not only extends the life of your pavement, but it really can save you money in the process. So as we talk about the evaluation, which is really where it starts, right? We start with looking at how do we as a consultant look at your pavement. In the past, we've done the industry has done a lot of boots on the ground, a lot of visual inspections. Many of you have probably seen those reports where it's just some pictures and it's just a PASER rating or it's just a generalized review of your pavement. We really want to focus on what's called a PCI score, which is based on an ASTM. PCI stands for Pavement Condition Index scoring. And we look at that when we do our evaluations to provide that heat map. We want to be able to show you on a heat map that is provided through our proprietary Pave AI technology. And we're happy to show you that Pave AI technology, but that PCI score comes through as a heat map to show you, like this picture, where are you having degradation on your pavement? And where do you really need to start looking at that? So this is something that's moving in the trend of the industry. So and Terracon's leading that to be able to show you that what contractors can't provide to you from an overall view of the pavement and what that looks like. This allows you to see exactly where you need to be spending your money. When you're looking at this and you're saying, okay, I know I need to be doing some reconstruction in the middle of this parking lot. Not only does it say this is where I need to be spending my money and budgeting this year, but it also helps us review where you need to be doing additional services like some coring or borings to understand what the thickness of your pavements are to be able to determine can you do the level of reconstruction or the mill and overlay that you want to be doing or need to be doing from a budgeting perspective on the overall of your pavement. But it all starts with that evaluation and understanding what the condition of your pavement is at the beginning to help you decide what that long-term strategy is. Many of you have gotten and been working with contractors for many years and understanding what that looks like. And you've gotten stories from those or you've gotten quotes from those contractors and said, okay, I'm going to get 3 bids. And all 3 of those bids have said different things. They've given you different opinions. They've given you different pricing. With Terracon, we are a third-party consulting engineering firm that you can trust our data to be able to provide you that single source of information. Again, when we look at that, we're looking at it through your lens, through your eyes, to make sure that we are helping you save the money, extend the length of your pavement, and provide you the data and the information to help you more efficiently utilize your contractors that you have the relationships with at that local level. And if we can do that, right, we will extend the life of your pavement. We will help you save money. You'll have better relationships with those contractors because they'll know exactly what your expectations are for your pavement. And that's what we can do for you as a consultant on your pavement. We look at it from a true third-party perspective, that objective approach to using a program, right? Our goal, as I've said, is to extend the life of your pavement. If your pavement is designed for a 20-year, what can we help you do in that 20-year process to be able to extend the life of your pavement, to save the money? As you can see in this chart on the right-hand side, client A, right? They just build it and then they reconstruct it. They spend $1.9 million. But if we can put together that program that says at this interval, at this time of the life cycle of that pavement, you do certain things like mill and overlays, surface treatments, based upon our evaluations that are done every 3 to 5 years on your pavement, we can reduce those costs down to $1.3 million as an example for this client, and potentially increase the life of that pavement from 20 years to 30 years or even more on the pavement that you're working on your project. And if you have multiple campuses or multiple sites, now you can start taking that data and start benchmarking it against those sites to determine where you need to be budgeting the money and which sites and which area of those pavements need to be coming first. And if we can do that correctly, we'll achieve our goals of extending the life of your pavement and helping you save money through the end. So there's a couple things we always want to help you understand is, do you have a strategic plan in your pavement for your pavement assets, right? Pavement assets, when we talk to asset managers, property managers, building managers, CFOs, CEOs, pavements is an asset that you're managing, but a lot of times it's because it's not a leaky roof that Greg's going to talk about, or other indoor air quality issues that Amanda's going to talk about. It's something that's outside, and it's not always at the front of the mind, but it is a large asset that you're managing. But do you have a plan to manage that asset from a cost perspective? And then budgeting, right? How are your annual capital expenditures allocated? Do you need to break apart your pavement in different sections? And when we do our evaluations, we can break those segments into pieces for you. We can understand what your front of house looks like versus your back of house. We can do north, south, east, west, however it is that you need to break apart or to prioritize those areas in your budgets. We can help you to understand that from a budgeting perspective, which then again helps you, even if it's from one site or multiple sites, from a budgeting perspective. And then certainly from a design perspective, right? Do you have an engineering team that is helping you to consistently, effectively, and efficiently manage that portfolio for you? Are you short-staffed? Are you in a position where you've got one person managing all of your pavement, but they really rely on the local teams, which are busy doing other things, managing that? And how can Terracon be that partner for you to manage your pavements on your sites? Operations, do you have negative impact, right? The picture that I showed at the very beginning, helping you understand, from a social aspect perspective or from an operational and maintenance perspective, are there ways that we can improve your operational efficiencies on your property through better pavement management? I talked earlier about an example of one of the clients that we've been working with for 20 years, and I'm happy to explain this graph in a little bit more detail if somebody has some specific questions. But the process of proper pavement management for this client over the past 20 years has saved them $35 million. Now, this is a client that has 16 million square feet, 16 campuses, 32 campuses, 16 individual property managers. So they've got a large campus portfolio. Your site may not be this big, but it is impactful where we can provide you back long-term this consistent types of savings and planning for your pavement. So when we're talking about pavement consulting with Terracon, it's important that we talk about what can we do to evaluate your process for you? What can we do to help be a partner to help you design more efficient pavements and be that partner for any potential construction activities that you need to be? And then certainly help you with other activities from an operational perspective to design and manage your pavements. We're excited about the opportunity to continue to have conversations with many of you about pavement consulting on your projects, and we're excited about it. But now that we've talked about the outside of the building, we're going to talk with Amanda, and she's going to tell you a little bit about how she can help you on the inside of your building from an indoor air quality and a hygiene perspective. So Amanda, take it away.
All right. Thanks, Bill. So Bill mentioned a bit about safety and risk assessment associated with pavement. And we wear that hat too when we walk on the inside of the building and we're talking about industrial hygiene. So industrial hygienists are crucial in a healthcare setting, and we're critical in identifying and controlling workplace hazards, protecting both patients and staff from various health risks. Industrial hygienists play a vital role in ensuring a safe and healthy environment, including managing exposures to hazardous materials, infections, and environmental factors. So let's just take a few minutes and explore some of the common industrial hygiene concerns that we have in healthcare facilities. So infection control, patient welfare, and worker health. In healthcare, the industrial hygienist should have really specialized training in each of these areas. There's unique conditions in hospitals and other healthcare facilities. And because these structures are designed to protect vulnerable populations, like patients, their standards for safety are different and much higher than, say, a school or an office building. Healthcare industrial hygienists can be an important part of the hospital's infection control team and often partner with infection preventionists to minimize a risk of hospital-acquired infections. I will say, though, as if you're not familiar with industrial hygienists, we're pretty well-rounded. We are used to working with not just on the side of patient care, but on the side of worker protection and public health as well. So the workers are not neglected in any way. They're an important member of the hospital community, and industrial hygienists are concerned with maintaining the health of workers, including protecting them from things here like you see hazardous drugs in pharmacy compounding areas, chemicals during those cleanups, pathogens and infectious agents, waste anesthetic gases during surgical procedures are just some of those examples. Industrial hygienists in the healthcare setting need to communicate effectively with several departments. I mentioned infection preventionists and infection control, but you've also got facilities management to ensure we have a safe and healthy environment for both the patients and the staff. Some key areas of collaboration would include the infection control, facilities management, pharmacy, surgery, nursing staff, and you see things here like Legionella and water management plans, waste anesthetic gas exposures, indoor environmental quality. So we'll talk a little bit about some of those common workplace hazards and infection control concerns from an IH perspective. First, let's talk a bit about occupational exposures. Many times, more emphasis is placed on patient safety than staff safety. We hear a lot about that, right? The role of the IH or industrial hygienist takes into consideration the patient, staff, and public safety, like I mentioned before. Healthcare workers are exposed to a variety of occupational hazards, including infectious diseases, chemical exposures, and physical hazards like sharps, injuries, radiation injuries, ergonomic hazards like lift injuries, anesthetic gases, hazardous drugs, and chemicals that are used to clean and disinfect work surfaces and medical supplies can pose exposure risk to both employees and patients. In 2004, the National Institute of Occupational Safety and Health, or NIOSH, published the Preventing Occupational Exposures to Anti-Neoplastic and Other Hazardous Drugs in Healthcare Settings document. As part of this, NIOSH has published a list of hazardous drugs, which continues to be updated with the most recent update in 2024. NIOSH estimates that approximately 8 million healthcare workers may be exposed to hazardous drugs, which are known to cause serious side effects, not only in patients, but are capable of causing cancers, organ toxicity, fertility problems, genetic damage, and birth defects in healthcare workers. Healthcare workers handle numerous hazardous drugs on a daily basis, and this doesn't just include the pharmacy staff in the compounding areas and the cleaning areas. This is nurses, shipping and receiving staff, housekeeping staff, laundry and waste disposal staff. Drugs that are designated as cell-killing or what we call cytotoxic drugs, or anti-cancer drugs, which are also anti-neoplastic agents, are some of the most hazardous chemicals that we've ever developed. The USP, or United States Pharmacopeal Convention, Chapter 800, specifies engineering controls for handling hazardous drugs in healthcare settings with a focus on worker safety. Drug compounding for both hazardous and non-hazardous drugs are both typically conducted in the same pharmacy. However, there are many hospitals that have specialized pharmacies for compounding just hazardous drugs, and they have engineering controls in place to help control worker exposures, which would include some different ventilation controls and different biosafety cabinets and chemical safety cabinets. Healthcare workers need to be trained on the hazards associated with each hazardous drug, effective methods for controlling exposures, appropriate PPE use, and decontamination and sanitation. Now, I did mention just the hazardous drug exposures, but some of the things that Terracon monitors and we look at as industrial hygienists are the cleaning procedures associated with hazardous drug compounding and use. We've seen some worker exposures to ultraviolet light for decontamination. You see exposures, eye irritation and skin irritation. In addition, some common occupational exposures above OSHA and ACGIH occupational exposure limits to hydrogen peroxide, peracetic acid, and acetic acid occur during pharmacy and anti-room cleaning. Also, still on the topic of occupational exposures are waste anesthetic gases. You may have heard a lot about this recently, but waste anesthetic gases, or WAGs for short, include gases and vapors that escape from a patient's breathing circuit or through leaks through equipment or anesthesia equipment during surgical procedures. OSHA, or the Occupational Safety and Health Administration, estimates that more than 250,000 healthcare professionals face potential exposure to WAGs and are at risk of occupational illness. Healthcare workers in operating rooms, post-anesthesia care units, dental offices, and veterinary clinics are potentially exposed to WAGs. Exposures can be mitigated through use of many common engineering controls that we use in the industrial hygiene field, such as gas scavenging systems, good HAZCOM plans, training and awareness to staff, and regular equipment inspections. Something that I'd like to point out on this graphic here that I thought was interesting, at the very bottom, you'll see that 8% of anesthetists reported that they had not had any occupational exposure monitoring in the last 12 months. That's a really low number. So we're not really seeing how many people are exposed to waste anesthetic gases during these procedures. Now, on the topic of infection control and patient welfare, which is definitely a hot topic in the industrial hygiene world in healthcare settings, what's important here for management of your facility is when we combine the expertise of an industrial hygienist with infection prevention professionals, we can lead a more comprehensive and effective overall approach to infection control. Water management programs are a very important way for healthcare facilities to protect vulnerable patient populations and safeguard worker and public health. The Joint Commission, the Veterans Health Administration, and the CDC, for example, state that it's essential for healthcare facilities to have a water management program aligned with the American Society of Heating, Refrigerating, and Air Conditioning Engineers standards to limit the growth and spread of pathogens such as Legionella and other gram-negative bacteria. Water management programs, or WMPs, in compliance with the Association for the Advancement of Medical Instrumentation, or AMI, which I'll talk a little bit more about on the next slide or two, ensures that healthcare facilities achieve the highest standard in water quality, from tap water to critical water used in sterilizing, cleaning, and rinsing and disinfecting medical instruments. The industrial hygienist also collaborates with facilities engineering teams to assess, monitor, and recommend strategies to prevent and mitigate air quality hazards, such as construction-related dust and mold growth that can impact patient and worker health. This is not only key during ongoing renovation activities, but during emergency response events that require cleanup of Category 3 waters, chemical spills such as mercury, or other unforeseen events like hurricanes and flooding. Like I mentioned, for the AMI ST108, it's considered industry standard. I do want to point that out. It's not required by law, but adherence to this standard is considered a best practice and may be required by accreditation by organizations such as the Joint Commission. It only applies to water that touches your instrumentation. It's important to note there isn't a one-size-fits-all solution. It can be made facility specific and should be made facility specific. Water testing requirements are defined by the type of water and how it's used. You see here on the slide, the categories of water are broken down by utility water, critical water, and steam. I won't go into a lot of detail on what those mean, just to understand that there's different testing requirements for those different categories of water, and that it's important that you sample the different constituents for each of those categories of water. It requires an initial performance qualification followed by monthly or quarterly testing for various constituents. This will include water generation systems and at the point of use. I know that most of you have probably heard about Legionella and other gram-negative bacteria. Legionella can cause a type of pneumonia called Legionnaire's disease in persons at risk. The CDC recommends, and the Centers for Medicare and Medicaid Services, or CMS, require that healthcare facilities include in the scope of ASHRAE Standard 188, developing and implementing comprehensive water management plans or programs. They help reduce the risk for Legionella growth and transmission. Something important here to remember is that outbreaks generally are linked to environmental reservoirs in large or complex water systems, including those found in healthcare facilities such as hospitals and long-term care facilities. The transmission occurs via aerosols from devices such as shower heads, cooling towers, and in healthcare, I'd like to point out this also occurs in medical devices like CPAPs, hydrotherapy equipment, bronchoscopes, heater-cooler units, and these are spread through contaminated water droplets via aerosolization. Good news is you can control Legionella pretty easily by temperature control. Maintain your hot water temperatures above 145 degrees Fahrenheit and cold water temperatures below 68 degrees Fahrenheit. Flush infrequently used outlets regularly. Don't allow for stagnation. Hot water storage tanks need to be drained and periodically and remove scale and sediment. Address poor maintenance areas and look for biofilm. It's critical. And lastly, but definitely not least, renovation and demolition. And this is a big one when we're still looking inside the building and outside the building. Renovations and demolition in hospital present numerous hazards, including infection control risks, airborne contaminants, and noise-induced stress, which a lot of folks don't think about. These projects can disrupt essential services, impact patient safety, and expose individuals to hazardous materials like asbestos. And as a reminder, the EPA requires asbestos surveys prior to any building renovation or demolition, regardless of the date of construction. This includes fully operational and active hospitals and healthcare facilities. Proper handling and disposal of asbestos and other hazardous materials are crucial. Construction activities generate dust, debris, and airborne contaminants, compromising the sterile environment that's critical for patient recovery. Intrusive activities like drilling and demolition create and release mold and bacteria. Dust control plans in coordination with infection control need to be in compliance with internal infection control risk assessment requirements, and it's critical during construction and renovation. Using physical barriers can help with this. Ventilation controls to control dust can help with this. Sometimes there's also unexpected water leaks or water intrusion events, such as those that are associated with plumbing leaks or storm events like flooding and hurricanes. These water intrusion events may impact the building envelope and cause mold growth in hidden wall cavities or interstitial ceiling spaces. Or you may have improper HVAC design that could cause mold growth on cooling coils, inside air supply ductwork, or on interior air handling components, compromising indoor air quality and occupant safety. That is stepping a little bit outside of my wheelhouse and into our facility services. So to talk more about buildings themselves and their systems, I'd like to turn it over to my colleague, Greg Walterscheid, on our facilities team. Greg?
Thanks, Amanda. Obviously, with the topics that Bill have discussed, that Amanda discussed, the infrastructure of a healthcare facility is unique to say the least. Critical procedures and operations are ongoing in healthcare facilities that require the building itself to be in tip-top performance, much like the health they're trying to restore or maintain. But from that perspective, the buildings can get sick if not well maintained, that you have to pay attention as building managers, engineers, asset managers to that regard, because once they're constructed, it's challenging that it's constructed in a way that it was designed and in systems installed. So sometimes those buildings can have issues from the day that they're occupied, much less over the years of operation. Those systems are not well maintained, or they're defective in nature, or they just wear out and cause some issues that stop that building from performing to its optimum condition, and therefore impacting the operations literally of taking care of patients and for the occupants and the workers within those buildings. When the building stops performing, the building system stops performing, the trickle down is extremely critical in healthcare facilities, as you all know. So when we look at the hospital facility in itself, and you saw this picture earlier, but the things that the major systems that we look at, obviously mechanical and electrical, your roofing, keeping the water out from above, your building facade, that enclosure systems, those types of systems are often, again, to Bill's point, aesthetical, but also performance related. And so we'll talk a little bit more about those as critical. But again, all the systems may have varied importance to your building operations. Maybe it's aesthetics, maybe it's true performance, maintaining the comfort and interior of your buildings. So when we think about the mechanical and electrical and plumbing systems, you heard Amanda talk about plumbing and water, whether it was system, heating and cooling, or whether it was utilization within the operations of the hospital. Those mechanical systems have to be maintained. Filtration is critical. Oftentimes we see changes in usage for what that system may or may not have been designed. If a certain floor changes from a patient floor to a operating room floor, obviously the mechanical systems have to be modified to adjust that. And a lot of times owners are challenged to maintain and reset those system performance criteria, right, with mechanical systems, which brings us into the opportunities for commissioning and retro commissioning, just to do that, to make sure that those systems are operating for the use that's happening today or will happening in the near term. That resets that performance criteria for comfort and energy conservation, extending the service life of those systems, and obviously improving and maintaining the comfort of your occupants and workers in those buildings. When you look at that in today's, I mentioned sustainability around energy conservation, the easy steps of taking lighting and retrofitting some of these other systems are all opportunities within your mechanical systems to think about such a key function that they provide and what you can do and required to do to really maintain those in optimum performance. Roofing, everybody considers that out of sight, out of mind. But again, it's usually the first barrier to water infiltration, which can be so critical in a healthcare facility. The other thing that we demand of roofs is it's not just a roof up there. Oftentimes there's mechanical systems, exhaust vents, antenna satellite systems, maybe even other storage systems up there that were not intended or designed for that roofing system. So it adds to the level of challenge in terms of maintaining those roofing systems for extended service life and optimum performance. Then again, when you look at how that's designed, where the penetrations, the roof to wall transitions, even parapet conditions have to be maintained, have to be considered an asset that does wear out and that must be maintained, and dollars given to fund repair, restoration, or eventually replacement. Continuing on to the side of the building enclosure, very large aesthetic for healthcare facilities when you talk about natural lighting, things of that nature. So all of these systems of the building enclosure, windows, curtain walls, your doors, oftentimes balconies, even below grade conditions are opportunities for water infiltration, air and energy loss, things of that nature that require, again, maintenance and continual attention to maintain that building envelope, that barrier to the outside weather. We also add into that parking garages, healthcare, large populations move in and out and oftentimes have parking garages. Those become both a challenge to maintain and also maintain from a usage perspective for the general population who walking, parking, driving, and all those challenges with maintaining a structure in good condition. So we see a lot of weatherproofing need to maintain structural integrity on parking garages. So what do we do as facilities consultants? It's really about, our intent is to diagnose, much like a doctor, funny that relates, but much like a doctor, they're to diagnose and cure building conditions that may not be performing to their top expectation. So much like those, we review the case histories, we visually examine building systems, like Bill said, for paving, or whether it's a roofing system or the mechanical system. oftentimes we run some tests, infrared surveys, electronic leak detection, a lot of equipment and tools we have to help us do that diagnosis. And then we come up with an assessment and a corrective action plan, and providing those options to building owners for their choices in, is this a repair? Is this a total restoration? Is this a maintenance issue? Where can they spend their dollars, and giving them those options before they go through large scale funding and expenditure for those. But it's really about restoring and maintaining and restoring those systems for their optimum performance. And as Bill mentioned earlier, the goal for us is that building owners of healthcare facilities have long-term intentions. They're going to hold those buildings for a long time, and they need them to perform for a long time, maintain their asset value, and optimize the return on their investment. And that's what we're about, in helping those owners understand and how to maintain and keep those assets in top condition. So a topic I'll add in that correlates to some of the comments that Amanda made about disaster response, and how a facility like a healthcare facility is so crucial to be able to maintain operation. We'll talk a little bit about resiliency. And there's been a voluntary standard, ASTM E3429, about property risk assessments. And I want to let everybody know kind of the basics of what that standard is about. It's essentially an evaluation of a property and its ability to what it might be exposed to in terms of hazards, whether it's some areas of the country, a hurricane, it's tornadoes, is it flooding, is it extensive heat, but understanding what those potential impacts are, and then creating a game plan to how to respond and maintain the resiliency of your investment. We're seeing a lot of interest in these from insurance providers and carriers, as well as owners, because they have to use these facilities to maintain their revenue producing operations, right? And so just real quickly, the three basic stages of a PRA, as it's come to be known, is understanding the hazards, identifying those, evaluating what the risk of those hazards may be to your facility, and then, which really runs into both environmental impacts to the IH conditions, as well as to the infrastructure of that facility itself, and then identifying potential resiliency measures that an owner then has choices to make of whether they implement some of those measures prior to, or they prepare for those. The PRA is something that we are going to see more and more of. It ties to sustainability, the ability to sustain your operations and maintain those. But under the label of that PRA, it's a stepped process that's still voluntary in the industry, but one that everybody should be aware of, especially for healthcare facilities, and the critical nature of their purpose and intent for the public. So to kind of pull all this together, when we talk about building management, facility ownership, all of the things that Bill and Amanda talked about, it's really important that you know what you own, right? You understand the system conditions, the intents of those systems, how they are to perform, what your options are, and how do you do that? It goes back to what they both talked about in condition assessments, whether it's facility-wide or it's a particular system. Maybe it's the paving, maybe it's the roofing, maybe it's multiple campuses, maybe it's one. That's your option as an owner. But from a full, complete asset management approach, it's about understanding what you own of all the key systems in your building asset portfolio. Understanding conditions, identifying service life expectations, what your options are. Okay, that system is expected to be needed to be replaced 5 years from now. Setting realistic budgets and taking that forward into plans of action. What we see, and I think what Bill presented in his graphics about savings, is the process of facility asset management is about building confidence in your ability to plan and implement projects, right, that optimize performance of your building operations and maintaining that asset value. So it provides a ease of validation of need for funding and planning to the C-suite decision makers. And year one, it might be a tough conversation, but years 2 and 3, because this is a repeatable process. You saw Bill's flow path that was a loop. This is a continual feedback loop of asset management and how you can take that forward into understanding from what you own and taking that forward into knowing what you own and having a plan to address it. And again, all these things tie together for the optimum operation of your building and the comfort and care of the occupants that utilize your facilities. So with that, Stephanie, I'll turn it back to you.
Thank you very much, Greg, Amanda, and Bill. We appreciate it very much. That is the conclusion of the presentation, but we certainly open up the remaining time we have on today's call to you. So you can ask questions of these subject matter experts, make any comments. I don't see anything in the chat currently. Does anyone have a question they feel comfortable raising their hand and asking or placing in the chat? If not, I'll maybe get things started, get the party started, so to speak. Bill, let's go back to pavement a little bit and ask you if you could talk just a little bit more about the Pave AI technology specifically and how it can help clients with their pavement planning.
Yeah, it's a great question, Stephanie. So thank you for helping me with that.
Sure.
As technologies are increasing, Greg talked a little bit about it. Amanda talked about it. Technologies are changing inside of your buildings. Technology is also changing on the outside of the buildings, and how we do the assessments, how we look at that objective review. We're now utilizing an AI technology that Terracon has developed through partners and through internal methods that is called Pave AI. And when we do the evaluation, we put all of that data, all the pictures, all the information we collect on your sites, put it into this AI model. And what it does is instead of old school doing it where we do a network level where we're just doing 10 to 15% of the site and then saying your whole site is good based upon that 10 or 15%, Pave AI looks at the whole site as best we can. Now, we're not always able to look at the whole site because there's cars in the way, there's other obstructions, but the AI technology, right, gets down to sometimes that 2 millimeter resolution on the sites, whether we're utilizing a car to assess the site or whether we're using a drone to assess the site. But we take that data, and Pave AI allows us to more objectively and repeatedly look at that data. In the past, as we talked about, if I was doing an assessment and you, Stephanie, were doing an assessment on a site, on another site, although we may be trained to do it the same way, there's a lot of factors that come into that level of appreciation of review. So now what the clients are able to benefit from is the pictures being taken on the sites of their pavement and being run through Pave AI objectively and repeatedly, that data is being looked at from the same set of review process. And then that information is then translated back out to that planning process that we talked about, from that 3 years or 5 year planning process to clients to help them understand what their actions and budgets need to be for the next future of their pavement assessment program. So it's a new technology that's coming to market. We're excited about being at the forefront for that and having a patented product called Pave AI to be able to utilize on projects. It's a great technology, and we would love to show anybody on the call a little bit more information about that and show you the demo of what that looks like for your sites. And just happy to reach out if somebody has that opportunity and wants that need.
Appreciate that, Bill. Thank you. And that really teed up the fact that I do see there's some questions regarding whether or not these slides will be made available. I'm confirming that in the background as we speak, but we do have a follow-up email that will go out to all attendees providing contact information for our speakers today, because regardless of your role, regardless of your responsibility, we can certainly help, and we want to help. So we are asking that you reach out if we can be of assistance to you, or if there's additional information we need to, you might like us to present to your teams, that would be helpful, just in educating and creating more awareness around some of these needs and some of these resources and solutions. We'd be happy to do that. So please be on the lookout for that. And before we disconnect from this call, I will certainly confirm whether or not these slides can be made available to you. Thank you for the additional questions and comments. We do have a question here. What is our operational capacity for healthcare condition assessments post major disaster, like for example, hurricane events? And I know that is something that is very much in Amanda's wheelhouse. So Amanda, I'll punt that to you if you don't mind. And then maybe Greg might have a few comments to add to that. Amanda? She may have had. Greg, you want to go ahead and start? Yeah, Amanda's battling what I think is like laryngitis, so she's recovering. So she may be taking some sips of water as we continue. So Greg, go ahead. I'm sorry.
Yeah, so we do have, to your answer, Nathan, we do have a disaster response team that's nationally focused for a variety of types. Mostly those do occur on the coastal areas. We see most of that, but we do respond to some other things. Focus both in environmental and our facilities groups, depending on the need that you might have. And so, as with most things, it's about planning. And for our better clients and for those who are interested in engaging us, we try to have kind of a game plan in advance. So it'd be something we'd be glad to kind of talk to you, understand more of your needs, the number of facilities, things of that nature, where in that event, it's not just a call and you're just new to us, because we kind of commit those resources to some of our existing clients as a national company. And so it'd be worth talking about, but we do have that team and that sector of folks, and we pull folks from all of our offices with their skill set based on whether it might be a structural assessment need. It might be water infiltration in a building, so it's both environmental and facilities for the building enclosure. So a lot of aspects we can cover from that regard, but would love to chat to you more. So bottom line, the answer is yes, and would want to talk more so we can make sure we're ready as a possible vendor for you in that need.
Thank you, Greg. I appreciate that. And it sounds like Amanda may be having some technical issues, but thank you for covering that. And Amanda, if you are able to, if there's any additional information that might be helpful for Nathan, could you add that in the chat if you're unable to unmute and speak? You know, I am curious because we have a very diverse group of individuals representing a lot of different areas on this call. If any of you feel comfortable talking about some of the, you know, perhaps environmental health or safety challenges you are currently facing, if anyone feels comfortable talking about that. I know Amanda would love to talk about that. All right, no takers. That's fine. That's absolutely fine. I understand. And then Greg, you know, maybe as we conclude, are there, let's see, how would a building operator or a manager prioritize necessary projects to maintain asset value? Could you expand on that a little bit?
Yes, I think and the folks on the call probably experience this. You know, obviously our experience with building owners and managers, it's a squeaky wheel approach, right? In terms of funding, what gets funded first? It's about who complains the most, where they have the most complaints, or somebody's favorite project or favorite issue. And so what we're recommending is we change that approach to being a little bit more proactive, and go to the proactive mode. And it goes back to understanding what you own for the critical assets that you have in your building. And once you know that, you're not guessing anymore. You're not spending money where you shouldn't be or didn't need to be. Maybe that system could have been repaired versus replaced. And you have to understand what you own and know its condition, because it gives you the power of decision making, the power of options. And really, that's where it has to start. And really, then it's when I said a repeatable process earlier, we've just seen it time over time with clients. Is once they committed to the process, year over year, their life became much easier as building managers and building engineers and operators, because that process then created the value and started building the value. Bill showed cost savings, but you build the value of trust within your organization, whether it's purchasing or finance or the C-suite, whoever it is, the asset management. You start building that trust, and you're showing value both in hard and cost savings by managing your assets to this asset management approach. So that's where it starts, is understanding what you own, but you have to commit to the process. That's for sure.
Right. Well said. Thank you, Greg. There is an additional question here. Best point of contact to provide or continue rather discussion on disaster management for healthcare facilities. Absolutely. We can certainly do that, Nathan. We'll be glad to follow up with you. And as I mentioned, we will be following up, providing contact information for each of the individuals who presented today, for Greg and Bill and Amanda. And again, thank you so much for being on today's call and joining us. We hope it was educational and informational and helpful to each of you. Terracon is an engineering company. We talk about engineering and consulting, but we're really a data company. To Greg's point, we're trying to provide our clients with good data and solid information so that they are better informed, better able to make decisions regarding, the health and welfare, longevity, et cetera, efficiencies of their facilities and systems. So again, I hope information's shared today was helpful, and thank you all for being a part of today's webinar and discussion. And I hope you continue to have a great day and be safe in the days to come.